What's going on, fellas? Chris, Mike, how you guys doing today?
Very good, very good. It's going to be a good Sunday. Not much happened by way of 4th of July last night for us, so refreshed, full of water this morning, and ready to go.
Yeah, unfortunately for me too. I went pig hunting last night and didn't see a single pig. So I got to shoot some fireworks.
You at least got to do a little pew pew, right? You got to shoot a couple rounds off at a tree or something.
Oh yeah, we definitely fired some guns. Definitely keeping it America on 4th of July.
America. All right, hey Chris, go ahead and introduce our guests. These are guests that we've had on before, and it is such a phenomenal job. We figure we have them back again.
Yeah, absolutely. Paul initially came on, which was episode 57, and then Helia was episode 50. And like we were talking, it's crazy to even think that there was 7 episodes that passed between them. But I think the pandemic kind of threw everyone's sense of timing off a little bit. So, we're definitely glad to have them back on. There's going to be some announcements that they're going to make today that I think are very important. And, kind of the cornerstone of what we'll be talking about here is convalescent plasma. And, just to kind of give everyone a sense of what that is, it's a therapy that is essentially an experimental treatment that doctors are using for people with severe coronavirus disease, or COVID-19, so to speak. So, we brought Paul on. He's heading up an initiative in San Antonio that's extremely important. Helia is a immunologist by trade, so we absolutely love having her on and getting the correct scientific perspective around a lot of this. I'll let them kind of take it over from here in terms of what they're doing with the virus itself. So, Paul, you kind of want to kick it off. I know the last time we brought you on, you were just recovering from the coronavirus. Since then, you've done a lot of positive things in the city of San Antonio by way of getting out information not only to the public but to individuals about what convalescent plasma is, what the potential benefits of it are, and really how badly the need is in terms of having donors, which are basically the individuals that have recovered from COVID-19 and now have the antibodies to be able to donate. So I think, what you're going to speak on today is extremely important. Helia, I know you have a new initiative as well. So once Paul finishes, if you want to kind of kick it off and go from there, I think that'd be phenomenal as well. But, we're excited. It's going to be a lot of fun today. So Paul, go ahead, man.
Well, I guess you covered what it is. You covered plasma and what it is, convalescent plasma, that's used only from the plasma of people that have recovered from COVID and given to patients that have life-threatening cases of COVID for the most part. So we started back when I donated for the first time. I think I was the 3rd donor in San Antonio. We didn't have, I think for 3 or 4 weeks after that, we got up to like 18 donors, while we had 300 people or so that had already recovered from it. Now we're at 4,500 plus people recovered in San Antonio, and we still probably have less than 120 donors total. And so it's a big issue because we're not being able to keep up with the demand for plasma from the hospitals. So I've been working with the local blood bank quite a bit to get the message out. I've done a couple of op-eds, one for the Rivard Report in San Antonio, and then I got interviewed by one of the columnists from the Express News, Gilbert Garcia, and he did a good write-up. And everybody first goes to, they want to know my personal story, and I'm happy to tell that, but it has nothing. It's not my story that matters. It's everybody's story that matters, and it's the message about getting plasma that matters most to me now. So I've just become a big advocate for it. And then once I saw back in May, the Mayo Clinic's study of the first 5,000 patients, and I saw how successful it was, I got even more interested in promoting it. And then in mid-June, they came out with their follow-up study that had expanded it to 20,000 patients. And they basically, what it showed was every month or every week that went by since they started giving plasma out within that 20,000 patient sample size, the mortality rate continued to 7-day mortality rate just continued to drop week over week over week over week. And so it made me really excited about it. I call it a bridge to the vaccine. And I know I've talked to some immunologists and epidemiologists locally, and they love that phrase because, they feel the same way. And so that's basically what it is.
Yeah, that's absolutely phenomenal. Helia, you want to, kind of piggyback off that, let everyone know what you're working on up in Boston in terms of, your new endeavor, which I think is just kind of getting off the ground, and then, your partnership that you're launching as well.
Yeah, absolutely. First, I do want to thank Paul and people like Paul who are donating, because it is very, very important. And I mean, I don't know if you guys know this, but we've been using plasma since the 20th century, before there was antibiotics, right, to treat even bacterial infections. And I like how you actually phrased it. What we call it, and I think my field is passive, passive immunity. When you vaccinate someone with a needle, right, and give them a piece of the virus, that's your active immunity that you want to give them. But this way, you already have someone who's built the immunity, and you take those antibodies and just give it to someone else, which passively should give them immunity. So I think it's a great way to treat a disease like this right now, especially with no other therapies out there and no active immunizations available right now. So what I've been working on is more of trying to figure out a, active immunization, right? So with the passive immunity, we can kind of treat all the critically ill right now, or we can try to, right? Because that's the best option we have. And also the thing that I struggled with a lot, and I think on the episode that I was on, I told everyone that we knew about this virus since 2015, right? So what I, as a scientist, struggle with is, why do we know that there's, these viruses and these things that can become a pandemic, and we're not prepared for them when they get here. So the mission of our company that we just founded, called CED Immunity, is to build a universal vaccine. So we're not going after the same regions of the virus to make a vaccine against. We're actually going towards the regions of the virus that are conserved, if you will. So they do not mutate. And a vaccine like this should actually work for however many mutations. So as an example, the flu vaccine right now, it's seasonal, right? Every season you have to go get a new flu vaccine. And sometimes in a given year, they even come out with a different vaccine later in that year that seems to be more protective, right? But if you have a universal vaccine, and a vaccine is built towards those conserved regions, theoretically that vaccine should, no matter what the strain of that virus, you should be, it should give you that immunity from the get-go. So that is what we're working on right now. It's a very small team. It's me, my friend Sophie Chappelle, who's the CEO or co-founder of 3 companies actually during this pandemic. She's amazing. And a retired professor from Utah University who's been researching this, believe it or not, for 10 years. So she's shown that she could make a universal vaccine against the flu. And so now we're kind of, our new endeavor is to do the same thing for coronaviruses and whatever the next strain might be. And so hopefully whatever the next pandemic, with this technology, you should be able to vaccinate people. And the way the company's set up right now, it's a not-for-profit company. So we really want to widely, if this works, which I hope it does, we want to give access to people. So we're looking at partnering with the Gates Foundation down the road, or somebody who will then take it, manufacture it, and give it to people, because we can't do that. We're just, doing the little science and getting the technology set up, and then we want someone to actually get it to the people. So yeah, that's what I've been up to.
That's phenomenal. That all seemed like it happened very quickly too. So yeah, congratulations. So, one of the things, Paul, I think that we kind of talked about yesterday and touched on, I was telling John, it's funny, John and I have this notion that we have to kind of stage our calls, because if John and I get on a phone call, we'll be on a phone call for 45 minutes to an hour. It's never a 3-minute conversation. And Paul's kind of the same way, whether it's talking about boxing or something else, it's never just a quick conversation. So there you go. So, in saying that, Paul, I mean, kind of on a grassroots level, you're getting ready to head up an initiative, and I'm going to let you speak to that a little bit. But, San Antonio as a whole, I think it's a very close-knit city. I think it's kind of spread out a little bit more, but it still has a very small town feel to it. So I think you can not only make change very quickly and implement that, but I think you can influence a lot of the factors that revolve around that city in terms, not only, from a psychological standpoint and from a political standpoint, but I was there when the Spurs won their first championship in '99 during the lockout season. And I mean, everyone came together in a matter of a couple of hours and it went insane. So for something like this that you're getting ready to kind of kick off a little bit, I'll let you get into the details and the nuance of it. But, you want to kind of speak to what your new initiative is and what your new goal is, and how that was born, I guess, not only out of your experience, but, also, I wouldn't say frustration or inaction, but really wanting to see this progress and save lives in a sense, and give individuals a bridge to, not only recovering, but there's a daisy chain effect that comes out of that as well, right? Being able to relieve, some of the enrollment on hospitals. We keep seeing, articles and the news cycle keeps saying, well, hospitals are, over enrolled right now. The ICU units are at 110%, et cetera. And I think, from a percentage and kind of mindset standpoint, that psychologically that drives the public, and they're like, well, how bad really is this? I don't think there's one clear message out there. And I think that's convoluted a lot of the process in terms of how people help, through donating things like plasma. I can tell you, just watching some of the local news as well, man, I haven't seen this discussion be had locally, and, which is why I wanted kind of Helio on, because after Paul finishes, one of the main questions we need to have and discussions we need to have is how we bridge that gap from the scientific community locally to figure out how we can kind of drive that. So Paul, I'll let you take it over and speak about your initiative, and, we can pivot off that as needed, man.
Well, it's simple. It started as an initiative where the mayor of San Antonio had sent him a picture of my plasma, me donating plasma. He asked me if he could put it on his Facebook page, his Twitter page, and he did. And then, everybody started calling, news stations started calling and asking for my story. And like I told you guys before, it wasn't really, I don't mind telling my story, but that needs to be like the first 30 seconds of whatever, conversation we're having. Because the bigger conversation is, now that I've had it, what can we do, all the people that have had it, to affect a positive outcome for our community? And so, again, I started looking at the successes of it. And, the Mayo Clinic, that study that I talked about earlier with you, it's shown really, really good numbers, really great numbers from a mortality rate standpoint. And it showed how every single week since it's been given out, it's been going down. The mortality rate has gone down, right? And so my like everything, the first issue is, how do you get the message across? So you can do it through a number of ways, but you need information. And so what I've been working on right now with the blood bank is trying to figure out how we get the information from affected patients. So the only people that hold that information right now are Metro Health, right? Metro Health has all the information on all the people that have tested positive for COVID in San Antonio. The hospitals have information on the folks that have been sick enough to go to the hospital with COVID, but that's only, a small percentage of the total number of people that have tested positive. So right now, what I'm trying to coalesce is hospital leadership, administration, to help us get the message out and to help us really track the success of plasma. We know that they can't give us patient information because there's HIPAA violations there. But if they could give us aggregate data on the number of people that have gotten plasma in San Antonio, and then the number of people that have remained alive versus died that would be great aggregate data just to give an idea. You're not claiming that plasma is the only thing that saved them, but you're able to show a correlation there. And I think you can use that as a success story to then go sell it to the community, because I think everybody wants this to go away. You know, consumers want to have confidence that when they go out to the store, they're not going to get COVID and they're not going to die, right? Businesses want consumers to feel confident going to their stores, and businesses obviously don't want people to start passing away from going to their stores. So everybody's could be positively affected by getting this message out. And right now I'm just trying to figure out exactly how I'm going to get that message out. One of the things that I'm trying to work through, and we got to hash out some details, is putting together a video campaign, some kind of public awareness campaign, but it would hopefully include high profile community members from San Antonio, sports, Spurs players, elected officials, formerly elected officials, from both sides of the political aisle, so it doesn't become a political issue. It's a health issue, right? And then getting the message out and being clear and concise about it. There's two parts of the message. How can you give convalescent plasma? One, you had to have had COVID before. You have to have had a positive test or positive test for antibodies, and you have to be 14 days removed from your last symptom, right, in order to be able to give. And then when you go in, they check your titers, which are your level of antibodies every time you give, to make sure that you have enough antibodies so people are getting a good dose of the antibodies from you. And then the second thing is, how do you convey that to the 4,500 people currently out of the 2 million people in San Antonio? And part of that is understanding what pockets of town are being affected. I've been working really closely with one of our councilwomen, Adriana Rocha Garcia, who's been a huge help. She sent me a list of all of the most impacted zip codes. And if we can put a campaign together that uses those zip codes and targets those zip codes, then we could be effective in increasing the numbers of donors. And then the second part of it, and this is the part that I'm really trying to work through, because there's FDA guidelines that don't allow you to in some cases, but I want to be able to pay people for their donation. There's been, out of the 13,000 people that have been affected by COVID, how many of them were hourly employees who either couldn't work and they had to stay home for 2 weeks and lost out on the money that they would have made those 2 weeks, or even worse, couldn't work 2 weeks and were in the hospital and have hospital bills to pay. So if we can figure some way to give folks that donate, $100 or $150 for every time they donate, they can donate every 4 or 5 days if they have the antibodies remain in their blood. All of a sudden now you're paying, a car payment, or you're paying half a house payment in San Antonio, at least. And so, yeah, that's generally what I'm working on. Still trying to steer the ship a little bit. I would love for the local business community, those that I have spoken to in the local business community have all said, we're all in. Tell us when you got this thing set up. If we need to write a check to help you with the public awareness campaign, if we need to write a check to just, use to give away to donors that give, let's do it, right? So I've got about $25,000 or $30,000 verbally committed right now. And so now I'm just trying to figure out how I'm going to go through the process of getting that money to them. If it's something that we can set up directly through the blood bank, great. That's the easiest way. If we have to go through a separate nonprofit, then I've got to go find a nonprofit that's already created to be able to do that. Because in talking with my accountant on Friday about this, he said it takes 6 months to a year to get your nonprofit status approved. And so I can't tell people that, hey, this is a charitable write-off if you're going to give money, because I can't commit to that until it's been signed off, right? So that's it. That's where I am. Those are the things I'm working on.
Yeah, I think it definitely has to be an immediate, economic initiative, especially with, one of the things that I asked John to do was pull up. I was looking to see if there was a mayor's statement from yesterday, because it was July 4th week, and, kind of figure out exactly what the city of San Antonio wanted to do. And it looks like, from what I've found, and John's putting the chart up right now in the live chat, but So the latest numbers that San Antonio is reporting, and this is directly from TPR, which is a kind of subsidiary of NPR, so it's just Texas Public Radio. And it looks like, Ron came out yesterday with his Stay Home and Work Safe initiative. It looks like the latest numbers actually bring the case to 14,553, maintaining Bexar County's grim standard among the 4 or 5 Texas counties with the most cases. There was also an additional 5 deaths reported, which bring the death toll to 122. So technically there's 1,120 COVID-19 patients in local hospitals, with 304 in intensive care and 129 on ventilators. It's interesting data because, go ahead, Paul.
Well, I was just going to say something to your point before I forget. That is the whole reason that we have to get a bank of plasma. Plasma lasts for a year, right? And so I've been saying this since April that I wanted for us to build up a bank so that we could have a storage or a deposit of plasma just waiting for folks. And so, because the truth of the matter is, the Mayo Clinic study shows that, look, the sickest of the sick people are the ones getting plasma, right? And even the sickest of the sick have a very low mortality rate. It's 92%, or I'm sorry, 8% on average is the mortality, 7-day mortality rate for folks, the sickest of the sick, right? So if you can get them, this study also says that if you can get them plasma before they go to the ICU or within 14 days of symptoms, the success rate is through the roof. They're trying to calculate that right now, but it's higher. The mortality rate drops even more so. And so people keep judging everything based on the mortality rate, which I think is a key to look at, but it's not everything, right? Think about it. There's people that are going to be in the hospital for 2 or 3 weeks with this thing that are going to have medical bills through the roof. There's people that are coming out of this thing, people that get bad cases with lifelong disability caused by coronavirus. So if you have enough in the store to get it to everybody in the ICU and try to get those folks phased out of the ICU, and then you can start giving it to folks right as they go into the hospital, you clear up hospital capacity, you shorten bills, you shorten the amount of lifelong disability, and I think you also save lives. So absolutely. And that's, so in doing a bunch of reading, so I was trying to figure out how Bexar County was kind of triaging this in terms of distributing, medication or something like that. And on Saturday, I found a statement from Greg Abbott, which was just a, kind of a statewide statement that basically said hospitals in Bexar County, Comal, and Guadalupe were, and then this includes children's hospitals, because it looks like the virus is starting to attack younger and younger individuals. And Helia, you may want to speak to that a bit, but, they received or were receiving 63 cases of the Gilead drug, remdesivir, which is essentially just the, antiviral drug that they've been trying to treat COVID-19 with. So, it sounds like they're going with that because it's more readily available. But, I would. But what was the success rate of that?
100%. And that's what I don't know. So it actually had a disclaimer that said the drug may help patients recover sooner. And I'm not a physician. I am not involved in the scientific community in any way. Let me just kind of preface that. But, from what I've seen from individuals that I have personally known, that have received plasma donations. I mean, Paul, and kind of exactly where I'm going with this, with Lawrence's story. I'm not going to tell it because I don't want to water it down. There's a whole Facebook post, but he was in the hospital in extremely bad shape. And if I'm not mistaken, he actually got a plasma donation and recovered very, very quickly. So, it sounds like this is working. And it sounds like, there is regional communities that are kind of starting to move towards this. I mean, we'll put some data up here in a little bit after I get, to kind of Helia's point, but it looks like in New York, I remember when we were first quarantined, all of the news that was coming out in New York was just extremely dire. They couldn't get things under control. There were cooling trucks that were parked behind the hospital because they were wheeling out dead people. I mean, the optics of it and the psychological aspect of it, I think, were just terrible. But they have it somewhat under control now. And, it's one of the things that we'll talk about a little bit later in the show, but the Orthodox Jewish community, really led a charge for, making plasma donations, and they've been kind of wildly successful with it. So I think, San Antonio, with the way San Antonio's set up, not only from, the Hispanic community standpoint, but I think that there could be real change driven there, which is why Paul's message is really kind of so important. So, it's Helia, from the aspect of bridging that gap locally. I mean, in terms of the plasma donations, San Antonio pretty well, because of your educational background. So, all of us on this call, say for John, we're educated in San Antonio to at least an undergrad extent. So, I would like to see, discussions continue to be had about this, but, in terms of getting the plasma donations there, I mean, how do you think we can bridge that gap, Helia, to make it make sense?
Yeah, absolutely. So a few points, and San Antonio is a very tight-knit community, just like you said. And I don't know if you followed, so I got my PhD at the medical school at UT Health Science Center. And UT Health is doing a fantastic job, even with their Instagram presence, where they run polls and they ask questions of, for example, is wearing a mask, yada, yada. Like, they ask these questions and you can do that yes, no. So it's an educational tool. And they put out a few videos talking about, how to help the community with social distancing and whatnot. And then educating about plasma versus serum, because a lot of people also don't understand when they go, you can donate your plasma, reason being, when you split up your whole blood, right, you get 3 layers. You get the blood, you get a plasma on top, which has it has albumin in it, it has immunoglobulins, which are your antibodies that you want. It also has clotting factors, which is what you want. However, the serum does not have the clotting factors, and that's what you use for your antibody titers, or when you get tested to see, if you've recovered or if you've been exposed to it. So they do a really good job educating the community, and they have a very good relationship with the Blood and Tissue Bank in San Antonio. So I actually think, Paul, it would be very helpful to reach out, and I can help you with that. I know the Dean of Medicine there. And as far as, you said that you want to incentivize some English words I cannot pronounce still. That's very, very tricky. Just being involved in a lot of clinical trials. The FDA is very against, there's huge regulatory problems with that.
Yeah.
And it's because you can promote misconduct, you can promote so many things. But I feel like if you do reach out to the university, they have medical affairs people. They have people that, interact with the FDA on a daily basis to get their patents approved or run their clinical trials. And if not, I personally know a few people at the FDA that can help you,
I love that.
If you have an insight, you kind of know what they're looking for, right? And I think that could help speed up the process. And as far as the, remdesivir or the drugs that are being used, they have good clinical data as well. But the tricky part that I've heard up in Boston that they struggle with sometimes is if you want to use plasma as a treatment. So let's say any drug, right, that you use for a specific indication that it was approved for, right? If you take that tomorrow, there's a new disease and you say, I want to take this, whatever new drug X, and now I want to use it for renal cancer, let's say, something that it wasn't used for. You have to fill out an NID, right? A new investigational, basically a new investigational drug application to the FDA. And you kind of have to go through these hoops to allow you to treat with that new drug. Even though it's an FDA approved drug, it was not approved for that indication. So right now with plasma, if you go to the FDA website, I think it takes about 4 to 8 hours for a physician to fill out the form to get plasma to a patient. Now, if that patient is super critical conditions, then they call someone and they get a verbal authorization, and then they have to do all that later on. And I feel like knowing the ER docs that I know right now and infectious disease, specialists, I think they're working from 6 a.m. to midnight. It's very difficult also treatment-wise. So it's not as readily available as prescribing a drug that's already there. You just get it, you administer it, right? This is a virus, so, and that's an antiviral. You see, like, it's kind of so much easier to get that drug to people than it is to get the plasma.
Yeah.
So that's another thing that I think is difficult. So not only do you have to educate the community on what the benefits are, you also have to educate the physicians on what other loopholes and what other faster ways there are for them to, have access. And I think that again goes to, if you go back to the FDA and regulatory, there has to be another way, because in New York, they were the Hasidic Jews, Chris, the piece that you send us, the piece of news about this huge Hasidic Jew community in New York, that they were all donating plasma because they were affected, and they live in tight-knit communities. That was a whole live news broadcast here in the New England area. So in Boston, we had it for, and several days they talked about it. So I think that's, this one. So I think that's another thing, right? It's broadcasting these things not only to the community, but also to the physicians. It has to be you have to kind of talk to everyone to get this done.
So I want to pivot off that and get to Mike, because Mike is, from a military standpoint, Mike is, and I've said this before, but Mike doesn't empty thought anything. If you bring Mike something, Mike's going to try to figure out what a solution is to it. He's going to look at the problem and figure out what the solution is to it. And, one of the things that he's always championed, not only on the show, but knowing him personally before we started doing this, were, thoughts on leadership and how you get those messages across. And that's one of the things that he's always said, not only about the government, but just bottlenecks and getting information out in general is, Mike, I'm going to let you speak to this, but like you said, it was a whole live broadcast that was probably platformed all across every platform that we have, information highway wise. But, from what I understand, they came from Massachusetts, they came from Rhode Island, they came from Connecticut, and all of them segued. And it was, this was a weeks-long thing, and they have donated from what looks like thousands of bags of plasma, and they now have a stockpile to that. Hell, Mike, in San Antonio as well as I do, it's not very difficult to get a message out there once you get the right people involved. How would you do that? How would you do it in terms of staging the information, not only from a news standpoint, but getting the universities involved as well, because it is a very college-driven city, in terms of the higher education that they have there, and they have some phenomenal colleges there. Not only private, but UTSA as a whole. So, I think that, and I was thinking about this dynamic last night. If this isn't on the news nightly, and if the universities aren't championing this, that's a real problem.
Hey, so it was to the forefront of my mind after listening to you guys talk. And you guys have kind of already gone over a lot of the stuff that I wanted to talk about is, from a leadership perspective, or when you're trying to solve a problem, a lot of the times it comes down to, who do I need to network with to solve the problem? Who are my subject matter experts? So I guess my biggest question for you, Helia, and even Paul, is, who are the people that need to network with each other to solve this problem? Because solving any problem, we all know that this is going to be a networking issue. This is a networking problem.
Yeah.
Who is person A that needs to network with person B that needs to network with person C to bridge these gaps in the system? Because we all agree there's a lot of red tape that we've got to get past. There's a lot of factors that we have to take into consideration, from everybody from the medical community to politics to, media. So, right now, from just given kind of your guys' personal experience with this whole, situation, from the donating side to the immunology side, and as far as educating the public, because this is a mass educational, endeavor that we're really talking about, right? Because we're talking about this specific issue of plasma donation, and essentially what we're really talking about is adding another tool to our toolbox because I think the general consensus is a vaccine is a long ways away. So right now, what we're trying to do is add another tool to the toolbox as far as, you know, how to treat this thing. And the specific one is plasma. So how do we get from, you know, where we're at now to educating the public? And who are the people that we need to connect with each other to kind of, like you said, bridge that gap and make this thing happen way faster than it's been happening? That's my biggest question, is from your guys' perspective, who are those people?
Elliot, you want to go?
I was gonna volunteer you as a champion to connect all those people.
Well,
but I mean,
well, and that's exactly what's been kind of happening. So I'll tell you all the work that I've been doing. So I think just keep in mind, there's 5 different players in this thing. It's your elected leadership, it's your hospital systems, it's Metro Health, it's the blood bank, obviously, and then finally to support funding and financial resources, it's the business community. And so what I've been doing is I've been working with elected leaders, talking to the mayor, talking to the county judge, talking to several council people, and figuring out how we can get all of these folks together to push this campaign in the right direction. It needs to be a team sport, because just like in football, you can't run down the field if you don't have blockers, right? And so Metro Health has to work with, or elected officials have to tell Metro Health to figure out ways that we can start tracing folks early and figure out how to contact them. The blood bank needs to put the marketing campaign together with me and with folks that I'm working with. One of the people that has been very, very generous in this endeavor is Trista Berry, who's running for a county commissioner spot right now, but she has a PR company, and they have offered some pro bono work for this endeavor right now up front. And they're trying to put the message together. It's the business community coming together to fund either a campaign or or a campaign for public awareness, and you know, whether we figure out a way to get people, you know, gift cards or whatever in exchange for their donations. And so a lot of these conversations are being had. You know, Joe Cryer, who was my mentor, and he was the chamber president for 25 years. I talked to him this week, and he immediately put me in contact with our county judge, who's going to put me in contact with the president of University Health Systems, the Bexar County Hospital, to see how they can help us get the word out.
I know him. I can help you.
George Hernandez. I went to school with his son, with both of his sons. They're really nice people.
You know what's really funny is the more I listen to this conversation, like the more you start to realize that the connections are there if you go out.
They're there.
They're totally there. I mean, you know, you guys know people that you just wouldn't have thought, you know, each other, you know. I mean, Paul, I was telling you earlier, I know somebody who knows somebody that you know that we just would never think that we know each other. So it's just it's a networking problem. It's a networking solution. And this is, you know, we're talking about Texas and San Antonio right now. I mean, this doesn't matter what state you're in.
Well,
it just
I
has to be.
Gonna tell you, Paul, I think you left out a 6th component,
Okay,
and that being your community docs, your physicians. They're going to be your biggest advocates. They're the ones who, in the end of the day, have to ask for the treatment and give it to their patients. And
that's a good point. To your point earlier, where you were talking about the process for them, I don't know how they're doing it, but we are getting plasma units out in a pretty timely manner. Well, not timely manner, but every day, you know, locally, we send out between 80 and 90 units of plasma to the hospitals. My concern right now is that locally we're only creating less than half of that, and so we're having to import that from other communities. So it comes in, it has to wait to be thawed, and all of a sudden, you know, you lose a day of having that plasma in somebody's body that could be going to work. I heard a story this morning from a friend of mine who said, yeah, his father's really, really sick. They ordered plasma, you know, and the plasma got here a day and a half ago, but they're still having to wait for it to thaw out. And he's had a really bad turn for the worse today and last night, and they're concerned that it's going to get to him too late. And so if we can figure out how to, because every time I've gone in there, they tell me this plasma will be in a hospital in San Antonio within hours of you giving it, right? So
So yeah,
I don't know
you should
how they fit.
find a person who's, asking the physician that's prescribing this treatment, right? And that's your
Yes.
best champion. They can walk you through what the process is for them, right? What the hurdles are. And I think that's where you could be that glue of, then you can bring in your network to fix that gap, right? Because we don't really know how it is for them.
Well, I really like that, and I wrote that down so that I can add them. And it made me think about the fact that there was a article in the newspaper, one of the new local newspapers 2 days ago, where there was a doctor from Methodist Health Systems that made a public plea for plasma. He said, "I've seen this effective, I've seen this work, but we're not getting it fast enough. So we need everybody to go give." So you're right. You're right. They can be a huge advocate.
Find them and bring them on the show, Paul. You know what I
All
mean?
right.
That's all I can say is, I mean, like, how do we get their voices out more, right?
Yeah, absolutely. That's, that's one of the more important things that Mike and I have, and John have talked about too. And John, I want to get your thoughts on some of this as well. But, we talked about yesterday, I mean, Paul, you have a platform whenever you need one. So, you just let us know whenever you want to do it, man. And then we can pivot awfully quick. But, John and I talked about that yesterday, and I know you can get out to local media and things like that, but whenever you want to reach a wider, diverse audience, man, it's here. Just let us know when.
Appreciate that. Very much so.
So I'm curious, just listening to this, I'm just enjoying the conversation and just playing producer, pulling up articles. But I did also want to say, Helly, I know you're on a trip, so I thank you for, we thank you for joining while you're on a trip here. But
I'm back. Connecticut to Massachusetts is about 2 hours. It's not Texas distance, you guys.
Oh, okay. Yeah, it's a day trip when we're going from state to state.
Yeah.
So I was curious, just like we talked about this before with you, Paul. And Helly, you said there was, we showed the article of what was happening up there in the New York area, but it doesn't seem to get beyond that. Like what's missing in terms of this getting to like a national, voice or national platform, I guess you could say. And even to that point, from a military perspective, I have cousins who, are in the medical field in the military. And I hadn't asked them about plasma. I probably should. But I'm curious why, like in that sense, what would it take to get them to start pushing and utilizing it in that facility as well?
Mike, actually, I was hoping that today you would talk about this, but in my opinion, it's all politics. I mean, the way our governors handled this whole situation, Boston or Massachusetts was the third hot zone. It was New York City, New Jersey, and then Massachusetts. It was awful here. And the way the governor handled it, I mean, he went in strict, he shut, when we had a shutdown, we're still in phase 2 of reopening. We're still in phase 2. The state has not reopened. And each reopening phase is about 3 weeks because they're very data driven, right? We see the data. If it's doing better, if the numbers are heading down, then we'll reopen little by little. And I do think it's a lot of, people actually, again, my opinion, but someone says, wear a mask, they wear a dang mask. It wasn't a big deal. Worst case scenario, if it's not good, if it doesn't help, it doesn't hurt, right? Doesn't matter what your political views. Everyone here in the New England area, I feel like we believe in experts, right? If Dr. Fauci goes up there and says, hey, wearing a mask will help, he's spent his entire life, treating patients and studying viruses. I trust the man, right? Whereas then there's that fine line of, well, it's our rights, it's all that other stuff, all this pushback, right? Which I feel like some other states have had. And honestly, in Texas, I think that's been huge. I still on a daily basis have to unfollow some of the feeds I see on my Facebook because I just cannot stand it. They have, they have all these wrong facts, these studies. My favorite was the study from Stanford University that was talking about the mortality rate of this virus and how it's less than the flu virus. And it was from Stanford. And of course, as soon as you open the article, on top in fine print, it says that this article is not peer reviewed. So to me, it's peanuts. It means nothing, right? But of course, you show that to, I feel like people go online and they research whatever it was they want for 5 minutes. And of course, if you search whatever you believe for 5 minutes, and all of a sudden they're experts and they know more than Fauci. And I mean, I've been called out, like, you don't know what you're talking about. That's not how antibodies work. And I'm like, I studied in the antibody lab. Like, what are you talking about? I make them. What are you talking about? So I do really, in my opinion, it's politics. You cannot make this thing nationwide when all of our leaders are treating it so differently. Leadership has been, I've been shocked. It felt like, to me, some of the things I hear, I was like, am I back in Iran? Like, what's going on, people? This is America.
Mike's just smiling over there.
I know. I'm waiting for him.
I made this comment. I made this comment in the pre-show, and I was like, if our leaders knew how to solve problems, we wouldn't be. Can you even imagine what this country would actually look like right now if our leaders knew how to actually solve problems? Look at where we're at right now. Just even before the virus, right? So it's like politics has completely, and I'm talking like politics has completely consumed like every aspect of our lives. The politics in your little league, all the way up to, politics in the federal government has just completely consumed everything to where you can't get anything done. You can't solve any problems. It's crazy. And then you've got, to your point, you throw in the mix of, there's just so much information out there that, there's, who can you really believe, especially when politics is involved? Because I've got a different personal view when it comes to, just even somebody like Fauci, right? Because Fauci's been in government or intertwined with government for so long. A lot of people on a certain, in certain areas of the political spectrum just won't trust him simply because he's been involved in the political space for so long, right? And so doesn't matter what his credentials are a lot of times. And that's a problem because if politics has consumed or infected things to the point to where if you've got a certain, credential behind your name, but people are just guard you because of, your political leanings or where you've been for your whole career, then that's a serious problem because, like you said, people rely on experts. If you've got brain surgeon behind your name, I'm gonna kind of take you seriously when it comes to the potential for me to have to have brain surgery,
But I can watch a YouTube video and do your brain surgery because that's how it works.
If it was that easy, right? It was that easy. So, I agree with you, 100% agree with you that a lot of it really boils down to politics. But this is where the conversations that we're having, on a smaller level, are really important because, our conversation isn't going to change what happens at the federal level, right? We need to worry about what happens at the local and state level. And then hopefully that bleeds up to, another state paying attention, and then maybe somewhere down the line, it happens more on a federal level. But these conversations need to happen because, for better or worse, right? We are more concerned with how our local communities are being affected by this.
Right.
But so if you can get sorry, Mike, I thought you were done.
No, you're good. Go for it, bro.
I want to say if we can have billboards that have scrolling numbers of the dollar amounts for the Texas lottery, then we can have a scrolling number that shows how many people have given plasma and how many people needed plasma every day, right? And if we can use that to create the awareness campaign, it's easy. So I had a question for Elliot about immunology as it relates to this. I've heard a lot of anecdotes about people that end up in San Antonio hospitals because I have been working so closely with the South Texas Blood and Tissue Center. And because I was one of the first to donate, I heard all the first 4 or 5 stories, right? And anecdotally, what I'll say is the first 3 people that got plasma were 24 to 40 hours, had been given 24 to 48 hours to live. All of them were off ventilators within a week, and all of them were out of the hospital within 2 weeks of receiving plasma. You hear other stories. Friends of mine, I have one friend that has actually gotten plasma. He said he was feeling terrible, started early renal failure, got plasma on a Saturday night. He was out of the hospital by Monday, right? So there's a lot of anecdotal evidence that's showing it works. But here's the other thing that I've heard along this process, and this is not to shame anybody, any group of people, but I was really worried about when this took hold in San Antonio, because our obesity rate is 65%, right? And this, you see all these young people that have quote unquote no underlying health conditions, but every time I see a picture or I see somebody that is a friend who's 30-year-old friend or 35-year-old friend gets a really bad case, one of 2 things is happening. A, they're waiting way too long to go to the hospital. They have double pneumonia by the time they go to the hospital. Or B, they're heavily obese. Can you speak to that from an immunology standpoint? Like, what can we also do to talk about make good habits and how that can build or help build your immunity? Not saying you're not going to get it. I got it, and I consider myself a pretty healthy guy. But I'll tell you what, when I got it, I cleaned up everything, and I had it for 6 or 7 days, and I want to think that making good decisions over the past few years have helped me fight it.
Yeah, no, that's a really good point. I mean, no more barbacoa tacos for breakfast. I'm just kidding. I miss breakfast tacos so bad in Massachusetts.
Putting a lot of people out of business saying something like that.
Oh, no, don't. It's like food for soul. But
I can't send you back to the East Coast with any brisket anymore.
Oh, I know. Chris and me vacuum sealed some brisket, and so we have brisket tacos. Well, we had one. We're still saving the rest, Chris. But yeah, that's an extremely good point. And so obesity is one thing. Think about it. Your immune system gets affected by stress, and obesity and those fat cells, that is stress on your body's cells. And thus, you have less immune responses. And there's a lot of studies already shown that if you're, obese, you don't respond to infections as well. Another thing in San Antonio that's very big is a lot of people are genetically predisposed to have diabetes. We have a large Hispanic community there. And that's another big issue because diabetes is a form of autoimmunity. So it does really impact your immune response. So
let me ask you a follow-up then.
Let
me ask you a follow-up, because my wife's a pediatrician, and so she has all these doctor friends, and I drive them nuts every once in a while when I've had 1 or 2 too many tequilas, and I feel like rocking the boat a little bit. I'll say, because I've heard that. Somebody told me a couple years ago, you're 40, you're going to be 40, you need to start getting your, checked up by the doctor regularly because you're predisposed to diabetes. And I said, am I really genetically predisposed? This is a question. Am I really genetically predisposed? Or is it because I grew up in a community that ate breakfast tacos every single day and ate tortillas every day, and I created an atmosphere of inflammation in my body, so that I grew up like that. So culturally, we grew up that way. Maize is inflammation producing. So my question is if you took Paul Basaldua out of this setting, and I was adopted by a white family in middle America that ate vegetables every day and white meat and fish, would I be still genetically predisposed for it? That's my question.
That's an excellent question. So there's genetics and there's epigenetics. So you're talking about both. So being genetically predisposed means you have a certain genes. You have this potential to have diabetes, and it's in your genes. I take your blood, I take the DNA out of your cells, and you have a certain mutation on a certain DNA that shows you're genetically predisposed. And then if you go and join that other family and you change your environment, your diet, which are your epigenetics, then epigenetics is kind of like a switch. You can turn something on or you can turn it off, right? So your environment plays a huge role in what things you turn on and off. So genetically disposed, but predisposed. But if you're eating healthy, you're exercising, then that switch remains off and you don't turn it on. But I mean, I don't know, if you have barbacoa every day, your chances of turning that on are much higher. So yeah.
Don't forget Big Red. Barbacoa and Big Red.
Oh my God.
Man, the best.
Well, you're suggesting that the Hispanic community completely dumb breakfast tacos?
No.
I wish you
No,
luck.
no.
I wish you luck.
That is
I won't be around to
criminal.
see it. And
I
I
We
know
have
my
partake.
kids won't be around to see it, but good luck.
Hey,
I partake. I partake on a regular basis, but just not every day, man.
Just not every
all.
day.
God, it's so
No
good.
menu
So
though
we do
good.
not
every
support
day.
that message, Paul. We do not support this
It's so-
message.
it's
This
so
is not
good.
a political
It's-
free agent sponsored message.
Oh
But,
my goodness.
You know, one of the questions that we had gotten in terms of plasma distribution was, you know, can mild cases get plasma distribution, and can it be given in an outpatient type treatment, or, you know, is it simply, you know, more so geared to the fact that they're saving that for advanced cases, and when the distribution of plasma is given, you know, I think they're there for research purposes. Would I be correct there?
Yep.
Yeah, that's kind of what I
you're hearing
figured.
more doctors. You're hearing more local doctors talk about getting it earlier right now.
Yeah. So, you know, and I think, Paul, I think that's kind of the, you know, in terms of, you know, one of the things that you had said earlier, you know, in donating plasma, that, you know, the comment that the plasma would be within the hospital in a few hours, you know, I think, and correct me if I'm wrong, but I think kind of speaks to the fact that there's no real storage bank of plasma in a surplus, which is why it's being distributed so quickly. Am I correct?
That's right. So they're sending me the blood bank sending me numbers every day. The numbers yesterday there were 69 units that got delivered to hospitals, but only 30 units were created locally. So that means 39 units had to be imported from places outside of San Antonio. For each imported unit, they're paying somewhere between $500 and $750. So a nonprofit blood bank, you can see what it's doing to them financially. First of all, you can do the math real quick and see if they're sending an average of 70 to 90 bags a day. Half of them have to get, you have to pay $500 to $700 for. There's tens of thousands of dollars you're losing every single day, right?
Absolutely.
But my big concern is that at some point, if all of those places that we're importing from have their own spikes, then we won't even have the opportunity to pay for plasma to get imported. And then you want to talk about hospital capacity issues, then you've got real problems, because you have half the people that get it will never have access to the plasma, right?
Yeah.
Hey, Paul, question for you after listening to that. So Helia, this kind of goes back to the question, or the what we're talking about as far as politics being one of the problems, is that when it comes to solutions, actual solutions to actual problems, a lot of times what happens is you're taking money out of somebody's pocket somewhere. That's why these things don't get solved, right? Because somebody somewhere is making money off of something, and that they don't want that problem solved. Now, I'm always the devil's advocate, so in my mind, I have to ask myself, is somebody making money off of the problem not being solved, or this, what we're talking about specifically when it comes to plasma, or the cost associated?
Helia is.
Yeah,
Helia is going to make a lot of money because the demand is going to be so pent up for a vaccine, man. I'm just kidding.
Hey, it's a nonprofit. We're going to put all the money back into the business to make more vaccines. We're not making
but I think,
money.
That's awesome.
I'm just in my mind, I'm always asking myself, is somebody making money somewhere to where they don't want it to happen, or they don't want the cost to come down? And
$2,500 is shipping.
What's that?
It's shipping. Shipping on dry ice is extremely expensive.
yeah, for sure,
Yes.
for sure,
Yes.
for sure. But I think, I think if you look at, to kind of answer that, Mike, I think if you look at the governor's comment earlier in regards to 63 cases of an anti-inflammatory drug being shipped, that's 63 cases that a government is purchasing directly from a pharma company. I mean, I would like to think that, I wouldn't like to think that, but point being is, there's your profit right there is, why solve an issue that isn't FDA certified yet?
I think you
why,
can overpower that though.
And that's exactly what I'm getting at. Is it takes someone in that leadership to champion that, and it takes someone that isn't fully embedded in long-term politics. I think that may be compromised, may have those interests already, and I think it's why someone like Ron would be a perfect candidate for it, because he's from the East Coast. The guy is very, very young. He's in good shape. He's well spoken. He's an attractive individual. He can attract a lot of attention. I think he would be one of the perfect candidates for it. And but that's just me. I don't live in the city of San Antonio. My ties there strictly go back to education and the 5 years that I spent there. But I think it's going to take someone like that to champion that and really want to make that change, because I think the further you go up the food chain, I think the more you're going to have corporate interest involved in it, which is why there's nothing being done. And once you get to places like the governorship, just throw it out the window. That's
just remember, all these guys are drinking through a water hose right now. They're having to deal with daily statistics that are coming in, informing the community daily. And so I think, I have challenged our mayor to get the message out more and more. And he's responded when I've gotten in touch with him. But I think it's the private businesses can yield a lot of movement on this endeavor. And so you're right. The cynical side says, okay, wait, hold on. Why are hospital rates going through the roof right now when you hear rumors of an average 4 or 5 day stay at the hospital? Should half of those people been in the hospital? If the average is 5 days, then were there people there for 2? Right. So if you're cynical, you start thinking why, right? You start asking that question. But from the cynical side of looking at like, okay, well, somebody's going to make a ton of money on a vaccine later on, and that's what's going to keep. I think that the rest of the business community has so much to lose by consumers lacking confidence to go out and spend money and consume and keeping the economy going, that the cumulative interest of the business community will outweigh any kind of special interest like that.
And don't get me wrong, I'm a capitalist, right? I have nothing wrong with money being made to solve the problem. What I'm talking about is money being made to keep the problem unsolved. And so it's information that is important for the public to know, is who's making money off of this and where is the money being made. Because if it's not being made in the ultimate goal, which is to solve the problem, then that's just as important of information as all the stuff that we're talking about right now, right? So like I said, I've got no problems with people making money off of solving this problem, which, that's just a natural, that's just something to capitalism. But
pay him in Bitcoin, Mike.
Absolutely.
That's like a rabbit hole you don't even want to go down right now.
That's exactly why I said it, because we're kind of over that 3 o'clock mark. But man, it's been, the conversation's has been incredible, and it's one of the things, and I kind of always make this comment, but and I'll make it again today, but I'm thankful to have individuals that we can get on the show like this and have real-time fluid discussions and be in agreement in what needs to be done. And it's why, so John initially kind of started the podcast to platform issues and problems and discuss them, because I think there's a real gap, or I know there's a real gap. We all know there's a real gap in the way the media portrays things and how that message gets filtered down. I haven't turned on the news station and literally sat in front of a TV since probably somewhere around 2010. And, I'd like to think that the majority of the individuals that I know are kind of the same way. And, we're some of the most informed people that there are out there. But, being able to have these conversations and, hear things like Kelly and Paul and Mike, knowing a lot of the same individuals, that's what it takes, and that's what it's all about. And that's how you drive, I think, real change from a grassroots level kind of up. So, I think it's going to continue to take these things to get that message out there. And, if change doesn't happen overnight, I mean, change is going to happen at some point. And, it's like I say, knowing Paul for as long as I've known him, Helly is a member of the family. It's going to happen at some point because they're the right individuals to do it. So, I think kind of last thing, summing things up and whatnot, Paul and Helly, I'll let you lead with this before we kind of segue it back to us. But, what are your closing messages with this in terms of, wanting to make sure that we get the right information out there, not only for, all of the pieces that we're trying to tie together, but, Paul, your direct message to individuals who have recovered from, this virus as a whole, you want to sum that up, kind of how they
Sure.
can be an integral part of this process, because we've had kind of a high level scientific discussion here with you guys involved in what you're dealing with. But I want to bring this back down a little bit and speak to everyone that might be watching and listening, and really let them know what they can do on their behalf.
Well, become educated, inform yourself is my answer. So first of all, before I completely answer that question, Helia, thank you for the work that you're doing on trying to come up with a vaccine, because that's the key to herd immunity long term, and that's going to make everything go back to hopefully living somewhat of a normal life. But to answer your question, Chris, I think there was multiple parts of it, so I'll try to cover it. The message is simple. We have a supply-demand issue locally with plasma. Plasma saves lives. It reduces the cost of healthcare. It reduces lifelong disability, and it reduces hospital capacity issues. So if you've had plasma and you want to help your local community recover from this, then go and donate often. You can donate every 4 or 5 days. I've donated 5 times now. Every time you go, you're not just saving one life, potentially you're saving, 4 or 5. And so that's the message I want to portray or send out there. And the message to our community is, especially our community leaders from all aspects of the community, is educate yourself. I've been shocked at the number of people that I would consider very well-informed leaders in this community that really don't grasp the difference between donating blood, donating plasma, and donating convalescent plasma that's used on COVID patients. It's been actually shocking. And it's funny because I've had so many conversations with folks where you hear the click. You hear like, oh, okay, wait, what? You're only going for 4,000 people. What do you mean? So, well, there's only 4,000 people that have recovered. Those are the only people we need. That is our audience. And then it clicks. So the more we can talk about it, the more that people become informed and educated on what it is, the better position that we're all going to be in.
Absolutely.
Yeah,
Piggyback
that's
and add
phenomenal.
one thing to what Paul said. Please prevent the disease, wear masks, social distance. This thing is not gone. No need to go out in bars, just social distance. This could have been prevented.
So, hey, Helia, before you take off, let me just say something real quick. Mike and I have a friend of ours that's a physician's assistant down in the Valley, which is the Rio Grande Valley in South Texas. And right before we got on this, she actually sent me, and I just want to bring it up real quick, but she actually sent me something from the Falfurrias Fire Department, which essentially said that if individuals go and get tested and they don't come back and stay home, because that's starting to become an issue if they're asymptomatic, they're getting tested, and then testing's bottlenecked right now, so it's taking so long, they're going out into the public and they may potentially be spreading that disease. So, I know she'll be happy to hear exactly what you had to say, because it's something that she pinged Mike and I on last night for quite a while. Mike's just sitting there laughing because I know he's got something else he wants to segue into, but continue on, Helen.
Yes. Honestly, the best way to get rid of this is to prevent it, right? If there are no hosts for this virus, it's going to die. And then, then when we need treatments, there's plasma, there's all these good things we can do. And please educate yourself again for the 1000th time. Just set up a telehealth with your doctor. I mean, if you have cancer, you don't go on PubMed to see what your diagnosis is. Just set up a telehealth and ask
Or
all your
Facebook.
questions. Or YouTube.
Yeah, you don't go on Facebook to figure out what to do.
Yes. I really enjoyed it, you guys. Thanks for having me back on.
I did as well. Thank you, guys.
Like I said, I mean, as we kind of show close here, You know, I think both of you know that you have a platform whenever you need it, whatever, whatever it is from us. I mean, even if it's just getting on, even if you want to commandeer something yourselves, just let one of us know, and we'll be glad to help. I mean, I think that's one of the most important things that we've done with this is, like I said earlier, tie individuals together who, we may have just had no idea knew or operated in some of the same circles because it's not an everyday thing for us. But, it's been amazing to hear the discussion and it's amazing to see, what's being done in San Antonio, because I think if San Antonio can do it, growing up in South Texas, there's a certain individualism that exists with the people that grow up in, kind of South Central Texas, South Texas, and the Rio Grande Valley, to where, we're a very self-sustaining people. I think we've ran so close to the history of Texas for so long. We've self-sustained for so long. Our families have self-sustained for so long that, when it comes to, time to listen to, state authorities and things like that, the message has been convoluted so badly over time that, it's fractionated now, which is why I was wondering how long it would take to kind of get to South Texas and spread. And compared to the rest of the country, it took a very, very long time. But those numbers are exploding right now, man. And you guys know as well as anything is once you start getting further into, I'll just use San Antonio as a benchmark, and come over to Houston and go back down. A lot of what you deal with in the hospital systems are patients with underlying healthcare issues, but indigent individuals as well, individuals that don't have, insurances and things like that, that may have always been leery to go to the hospital, and now they're forced to because it's a life or death situation. So prevent that as much as you can, reduce the strain on some of the hospital systems. And if you have recovered from COVID-19, get involved and make a change and donate to, your local blood banks or wherever your donation drop off is. But that's all I really have to say. I appreciate you guys letting me, kind of moderate this thing and tie everybody together. Mike, John, y'all have any closing thoughts at all?
Mike, you can go ahead if you have anything, and then I'll close this out.
I'm good. I'm stewing because my dog peed on the floor right in front of me. So you guys finish it up.
That is hilarious. No better way to end it, Mike. Appreciate that. But we are the Political Free Agents. We thank Paul. We thank Helia for joining us. This has been a phenomenal episode. I just enjoyed listening and learning what I could here. We do this every Sunday, every Wednesday. You can catch us on YouTube. Hit the like, hit the subscribe so you can be notified when we go live. You can also monitor our social medias at PFA Podcast on Instagram, Twitter, and Facebook. And you can also check out the website, politicalfreeagents.com. And we're probably going to be joining Parler soon. So something we got to talk about, guys, to see if we want to tap into that audience. But check us out. We have a great episode coming up on Wednesday, a lot more on Bitcoin and how blockchain can impact us just as a people. So we are the Political Free Agents, and we're out. We are clear from audio. We are still live on Facebook for the post show.
That's John. I'm going to be you on Wednesday when we get into this cryptocurrency talk. As early on as I got into that thing, I've been absolutely terrible at following it and participating in it. So you guys are going to have to commandeer that discussion. Oh man,
I'm just going to be listening to Mike.
Yeah, that's Mike.
Lead that whole thing.
That's Mike.
I look down. There's this big puddle of piss right underneath my seat.
That's why I don't have any dogs anymore. They're done. They're over with.
God.
But no, it's Helia. I sent you and Paul a text message, just to make sure that y'all, cross communicate with each other.
Yeah, that's great. I actually wrote down a couple of names here that I'll send Paul the contact to. Yeah.
Perfect.
Awesome.
I love it. So did you say George Hernandez?
Yeah, and I know the Dean of Medicine at UT Health.
And what's her name? Is it Barbara? Dr. Barbara?
No, his name